Hi, I'm Dr. Daniel Bridge. I'm a chiropractor in Helena, Montana. Today we're going to talk about a certain type of knee pain where you get pain on the outside of your knee. People talk about IT band syndrome a lot. We're going to look at this a different way. Today we're going to go over some techniques that you can use to instantly get rid of this pain. The IT band is a long fibrous band that goes down from your hip all the way down and it inserts on the side of the knee. There's not muscle in it, it's a fibrous tissue. So by stretching it and by working it, you're not actually really going to loosen up that band. It's very taut, it's tight, that's the way it's supposed to be. So what we're really targeting is this muscle right up here. This is your tensor fascia lata. We call it the TFL for short. What happens is that muscle gets shortened and tightened, and that's going to pull the whole IT band upwards, and it's going to pull away from the knee, really causing that inflammation and pain on the side of the knee. So our goal is to get that muscle stretched out, get it loosened with some deep tissue work, and then strengthen that and other supportive muscles around the hip so that all the pressure isn't going straight onto that one muscle, causing it to tighten and shorten, causing this to pull up, and causing the pain on the outside of your knee. So let's go ahead and get started on those. So you could spend a lot of time working on the actual IT band itself. I like to actually focus up, instead of doing that, up above that bony bump on the side of your hip, you have quite a bit of meat through this area, and that's where the TFL lives. So by doing some deep tissue work here, whether it's massage or I'm going to show you how to use a foam roller on this spot, you can really get that muscle to relax and to get those knots worked out and to get it to function as it's supposed to. Get a foam roller and your body's going to be perpendicular to the foam roller, and arm out, support yourself on your forearm, and I step over with my, in this example, my left side, since I'm going to be working on my right TFL. So I brace myself here and there, and I'm going to roll that right above that bony bump on the side of my leg. And then I'm going to slowly roll down, and you roll down till you get to the top of that pelvis bone. It's called your iliac crest. So you have this space where you have the bony bump and then this ridge up here. You're going to be working all that muscle in between there. And you roll back and forth. Depending on how intense you want the pressure to be, you're going to put more or less support with this arm and with this leg as you roll back and forth. Also, you can turn your hips forwards and you can work some of those muscles on the front of the hip and get those fibers there. And at the same time, you can also rotate your hips forward so that you're working those muscles in the glutes, the piriformis. For me, all of those muscles in that area really need a lot of work. But when we're really targeting this pain on the side of your knee, that muscle right on the side, the TFL, that's what you're going to target. Just like you can use a foam roller, you can also get in there with a massage gun and really work around that muscle to get it to relax. As that relaxes, it's going to put some slack into this IT band, which will then in turn take pressure off that side of the knee where that's connecting to and pulling away from. Now that we got those muscles all worked out, the next thing we're going to do is we actually want to start to strengthen this area too. Because of the way the camera's focusing, pointed, I'm going to be working on my left side, but there's two exercises that can be good to stabilize these hip muscles. The first is your classic clam. You're going to lay on your side, knees together, heels together, and you keep your heels together and you bring that knee up while activating your gluteus medius. That's the muscle that's going to perform that. Now people will try to cheat by really rocking backwards. You don't want to do that. You want to keep your pelvis stacked and really feel the burn right there in that muscle. As you do that, the TFL is not going to be the only muscle supporting a lot of the side hip motion, and it's not going to get so stressed and strained and want to get all tightened up again. So that's your clams. You'll want to do 3 sets of 10. Do that daily. Another exercise that I like is you just lay flat on your side, keep your legs straight, keep your knees straight, and keep that, bring that foot up to the side and up towards the ceiling. Same thing, you'll want to do 3 sets of 10. A lot of times when we have a tight TFL, it is because it's weak. And I know that doesn't really make sense, but a strong TFL can be, or is a healthy TFL. So same instructions, 3 sets of 10 every day. And of course, with both this exercise and the climb exercise, you're going to want to do that on both sides, not just the side where you're having the pain in the knee. So our IT band runs from about here all the way down to the side of the knee. And that muscle, the TFL, lives up here, and we really want to stretch that out. Get yourself next to a wall and put your forearm against the wall. Put all your weight on the side that you're stretching. So in this case, I'm stretching my right side. And then with my left leg, I'm going to step over and across, and I'm going to bring my hip in towards the wall or whatever you're leaning against. As you do that, you should feel a really good stretch right through this area, right on the side of your hip. That's what you're looking for. That's going to stretch that out. That's going to get that muscle healthier. That's going to get that muscle to put slack into the IT band so it's not pulling away from your knee as much. Now, the hip tightness is a big problem for that pain on the side of the knee. Another stretch that I like to do is stretching out the hip flexors, the iliopsoas muscle. The way I do that is I lunge forward with the opposite leg, and this back leg, the leg that I'm stretching, I like to keep it straight at the knee. And I also like to keep my torso straight up and down. In order to get a stretch, I'm going to bend my left knee to bring that forward, bring my body forward, and then taking my right arm, I'm going to lean away from the side that I'm stretching, and I feel that right up through here. And you're going to hold that for 20 to 30 seconds on each side. You want to get both sides stretched out. The more that you bend this knee, the more stretch you're going to feel. And the more that you lean away from the side that you're stretching, also the more stretch you're going to feel. One way that you can really find out for yourself if it is the TFL, that tight hip, that's causing the pain on the outside of your knee, is take your thumb and really push into that muscle, or have a friend or family member do that where they can dig in. It's usually going to be a lot more tender and sensitive than the other side, unless you have that problem on both sides. So that's important, and that's always a light bulb moment for my patients when I go over that, is even though the pain is in the knee, the problem's not necessarily in that area. A lot of times it's in the hip. And you can also have hip pain going along with that. So those are two important things to keep in mind. Thank you so much for watching the video. Don't hesitate to reach out with any questions. I answer all the questions. You can test me on that. But let me know in the comments what's worked for you, what's helped you with this pain on the outside of your knee. See you next time.